Hey guys, it's Legit here. Um, I know that everybody has been having some questions regarding the lab practice, so I thought I'd make it easier for some of the TAs and for yourselves over the weekend if you guys wanted to review some of the questions that Mariah had made on this lab practice that was gone over on Thursday. Um, Maybe I could just make a video and make things um, a little bit more clear cut and give you guys a sense of peace if you want to review it and kind of get a little bit more of a functional understanding of anatomy and how to identify structures and how to rule things out. So, the Exam 1 lab practice was created by Mariah West, oops, who is the best. Thank you so much for making it. We appreciate you. Um, so now we'll just discuss some of the structures. So presented here are parts of the vertebral column. With the students who are with me, I kind of explained some things, so I'll go over and explain that everybody else can see. These are all vertebral columns for 3 different levels. This is from the cervical level, this is from the thoracic level, this is from the lumbar region. So there's ways that you can help yourself to identify which level it is from. So let's go from left to right. The first one, the cervical level, I'll kind of zoom in here. You can see that there's some identifying characteristics that are very important to helping you understand what is what. So the first part is these really obvious foramina that are only apparent in the cervical vertebrae. If you look at any of the other ones, these guys only have 1 holes, whereas this has 3 holes total, but there's 1 in the middle, and these are the 2 on the side. So, as you guys know, these are the transverse foramen. That's because they're on the sides. So you have the transverse foramen, then you have the actual vertebral foramen right down the middle, and every vertebrae has vertebral foramen, but only the cervical vertebrae have the transverse foramen. So those are a really helpful identifying landmark that you know that you're looking for, that will help you identify that you're in the cervical region. The other important thing that you want to check out and pay attention to, oops, sorry about that, is the bifidus spinous process. Bifitting meaning 2 prongs, like a fork has 3 prongs. Bifidus meaning 2 prongs. Every other vertebral column, every other aspect of the vertebrae in the thoracic and in the lumbar regions will only have this 1 spinous process, whereas in the cervical region you will have these 2. So it's important to remember that. It's a very helpful distinction. They're still called the spinous process, and unless instructors say be specific, I don't really think that you have to say it's of the cervical region, but it's definitely a really helpful identifying landmark. The next thing you want to know as for differentiation are the actual vertebral bodies, which is this big chunk of bone right over here. So you can see that they progressively get larger. So in the cervical, which is in the neck, which is the neck region, the thoracic, which is kind of like the upper back, and then the lumbar is the lower back. So you can see that as we progressively move downward, it just gets bigger. So with the lumbar being the biggest, then thoracic, then cervical. Now, why is this a thing? you need to kind of pay attention to this because vertebral bodies are weight-bearing regions. They hold the weight of everything above it. Now, if you have something this tiny, and imagine something this tiny right here of the cervical vertebral body trying to hold up everything above it, it's probably going to get crushed. But if you have something big, massive, with a lot of surface area, and it's really thick, it's going to be able to hold the weight of everything above it. So that's why you also want to start paying attention to the vertebral bodies and the size of the vertebral bodies into kind of helping yourself understand which region you are, maybe what vertebral body you're looking for, because those could be asked. Unlikely, I think, because I don't think they're specifically on your structures list that you have to know it, but just for safe measures, it will conceptually help you understand anatomy a lot more. So those were the vertebral bodies. The next thing we're gonna go look over are the spine, the actual vertebral arch. So this is the vertebral arch. Again, kind of apparent because it forms an arch. Now, this arch is made up of two parts. Well, technically, we could say 4 parts. So I'll show you what I mean by that. So if we draw a line through it just down the middle, we can see that and then maybe we could draw another line through the transverse process, and I'll just do it on this side. You can see that there is one part here, and then there's one part here. So those are very helpful, very important landmarks you got to know. And again, you can see them here and here with the landmark being the transverse process. Again, this is the transverse process. So the one in between the transverse process and the spinous process, you guys know that part is the lamina, which is being dictated by the yellow arrow, and then the black part, which is in between the transverse process is shown here. This is the vertebral body. This is the spinous process for labeling. So between the transverse process and the vertebral body, this is going to be your pedicle, which is P, as indicated here. And then in the yellow, between your spinous process and your transverse process, is going to be your lamina. So it's the same thing on the other side. If I draw a line and I just keep it going straight, I didn't draw it perfectly, but let me do that again. So there's a line, and I'm trying to draw it where the transverse process is pointing out, and then that's your helpful landmark. So it's in between the vertebral body, which is this region, and your transverse process. Then that's going to be your pedicle again, and then if it's between your transverse process and your spinous process, then that's going to be your lamina. So that's going to make up the whole arch. You're going to have, again, if I'm like just drawing out the same thing here, you have your lamina on each side, your left and right side, and then you have your pedicle on each side, and then you have your giant vertebral body. So I hope that clarifies things, makes it easier to understand. So that was everything to go over here. Mariah did an awesome job choosing that for us to get a conceptual understanding. So now what we're looking at, onto the next slide, is the scapula. The one on the left, right here, this is going to be the front of the scapula, and then here is going to be the back. This is important. You want to make sure which side you're looking at, because we can just show you just the scapula, and you have to orient yourself which side you're looking at. The easiest way to know is just to look at this giant line right here. This other part won't have a giant line. Instead, this other side is going to have this really nice bony outy part that's kind of extending anteriorly. So this is going out towards the front. So those are going to be helpful figures or helpful defining landmarks that you want to pay attention to notice if you're at the front or at the back of the scapula. So in the blue arrow, by the blue arrow, right here, that's going to be your coracoid process. And now your coracoid, you can even feel your coracoid process actually. It's all you want to do is like imagine you're feeling your clavicle, like feel your clavicle in the front, and then go out laterally, and then keep going out laterally, keep pressing your clavicle and going out laterally, moving towards the edge of your shoulder, and then this part, this coracoid process, I'm going to make a really crappy drawing here, but it's going to go ahead and connect with your clavicle out laterally. So if you keep palpating or touching your clavicle and then you move outwards, you're going to end up feeling your coracoid process. You're going to know you're at the coracoid process because it's going to hurt. That thing is sensitive. So sorry for the pain, but I hope it's helpful in at least identifying and giving you a very literal idea as to where it is on your own body. So that's what's on the blue. Next, we're going to go on to the back. The back is the acromion process. It's not actually at the back, it's just a little bit posterior to it, but it's more so superior. So you can see it's directly above the coracoid process. So you're not, so once you have, again, if I draw out my clavicle, or if I draw out a clavicle right here, this is my clavicle, and then I'm palpating and going laterally, and then I feel my coracoid process, and if I move up, and if I kind of move up with my fingers, there's my acromion process. So AC for acromion, CO for coracoid. So that's on the front. Those are the two major landmarks you want to keep in mind when you're at the front. Now we're going to go on to the back of the scapula. So as I said, the biggest thing you want to see at the back is this giant line. That is going to be the spinous process of the scapula, just basically the spine of the scapula. So that's a really, really important landmark to know because we use it to help name the muscles in relation to where it is. So there's some muscles that are above this thing, and there's some muscles that are below this thing. So if it's spinous, so it's spinous, spine of the scapula, right? So I'm just going to write spine here. If it's above, then it's superior. And if it's below, then it's inferior. So let's combine, and imagine there's this muscle here, then it's going to just be supra spinatus muscle. So we're just combining those two words here. And if it's below the spine of the scapula, then it's going to be infraspinatus muscle. So I hope that clarifies things in remembering the supra and infraspinatus muscles in relation to the scapula. The biggest landmark here is that you really want to pay attention to that spine of the scapula, which is noted by this orange arrow. We're trying to indicate this entire thing. Okay? So the back part of the arrow, the black arrow, sorry, this is the acromion process. Remember, I said that it was posteriorly and superiorly to the coracoid process. So this is how that acromion process would look from the back. Now, essentially, it's just the same thing, but mirrored. You will notice that it's on the most medial aspect of the scapula. So this is the lateral part. This is the medial part, and we're on the front. So this is the middle part. Again, this is where their clavicle was. Again, same thing here. This is my clavicle, we're looking at it from the back. Don't forget, this is my clavicle. Therefore, this is the medial part, and this is the lateral part. Alright, so we've gone over the medial and lateral aspects of the scapula, and now you kind of understand how they are in relation to the clavicle. So hopefully that clears a lot of things. And then lastly, there's one structure in yellow that needs to be noted, and that's the inferior angle of the scapula, as noted right here. So it's the inferior angle because, once again, if you just draw two straight lines like this, and then you notice the angle right here, it's the bottom angle at the very, so it's at the very bottom, hence making it the inferior angle of the scapula. So I hope that makes sense, and it shouldn't be too confusing to follow along. So let's go on to the next one. So what we're looking at here is the humerus. So we are seeing two sides of the humerus. So this humerus specifically, as you can see on the body anatomically, from the anatomical position, this is the right humerus. And what we're looking at on this side is the front of the right humerus, and this is the back of the right humerus. So this is what you should see if you're looking directly at the humerus, at the right humerus, from the front and the back. So there's a few landmarks that you want to pay attention to there, but for us, we'll just be focusing on what's been labeled here because that might be more relevant for the upcoming exam. So let's focus on the blue arrow. So on the right side, the most lateral part of the humerus, and since our shoulders are extremely wide, they're pretty much the most lateral aspect of our body. By the most lateral aspect, let me zoom in and you guys can see, like, this is the most lateral aspect. Don't worry about the arm extending out, but imagine if the arm was just going straight down. The most outer part is right here. Again, that's the same thing right here. So that's the most lateral part of the body, and that's going to be this little bony outy process. You're going to notice that there's two of them. There is one out laterally, and then there's one out a little more medially. So, and you also notice that one is bigger and one is smaller. So we call these processes the tubercles, because that's how we usually like to mention little nubs of bone that kind of come out. We just call them tubercles. So the bigger tubercle, we call the greater tubercle of the humerus, and then the smaller one is the lesser. This kind of makes sense, greater being bigger and the lesser being smaller. And once again, if there was any point where you had to know which tubercle was more lateral and more medial, this should help make things a little bit more clear, because you can see it pretty much exactly where they are in relation to the body. So this is, once again, the more lateral part, and this is the medial part. And then right here is where your humerus connects to your scapula, or your glenohumeral joint. That's going to be making up the part of the glenohumeral joint. I'll make that drawing a little bit better, so you can say this is the other part of the bone, and that's where it connects, and that's going to be where the joint forms. So now let's look at the image on the right. This is also, again, the right humerus, but now we're looking at it from the back side. Okay, that's a big thing. So what you want to know here from the back side. Let's orient ourselves first. So if this was the front, then you kind of know where the head is facing. This is the head of the humerus. The head is facing medially, and then the tubercle, which is right around here, and that's facing laterally. So now let's pay attention to the green arrow. The green arrow is pointing at the deltoid tuberosity. Again, I kind of said that any nubs of bone that are kind of coming out, we call them tubercles or tuberosity. And this specific pointy outy part, if we were to call it that, is going to be the deltoid tuberosity. And you can see it's lateral, it's on the lateral side. So if you go around here, and then let's go on to the front of the humerus, you can also see that it's on the lateral side. So just make sure that you use these landmarks to help orient yourself and confirm what you're looking at as they're presented to us on the exam, and hopefully that makes things a little bit more clear. Now there's another thing that we want to pay attention to, which is this tiny little black arrow. Again, where this is the front of the humerus that we're looking at we're looking at this part, we're looking at it from the front. And we notice that there's this little ridge in between the greater and the lesser tubercles. We call this the intertubercular groove. Inter meaning between, and tubercular meaning between the two tubercles, and it's basically a nice little ridge that's it's like a depressed part of the bone. So, and we call that a groove, so intertubercular groove. So I hope breaking the name down is a little bit more helpful, and so now you can kind of understand where everything is in relation to each other. So this is the greater tubercle, then there's the intertubercular groove, and then there's the lesser tubercle. And that is going from lateral to medial. All right, so this is just a review of what we went over. Next slide. All right, so now we're going on to the muscles. So these are the options that we have for the muscles. So kind of making this easier. If you want to fill this out yourself, you're more than welcome to. You guys have access to it. But I'll go ahead and try and I'll also go and try and give you some identification landmarks as to how to know which muscle is which. So right here, so first let's start off with number 4, which is a combination of 1, 2, and 3. So this is 1, this part is 2. Again, like imagine drawing a line through the middle, right? So then everything is mirrored. And that line, let's imagine that to be our spine. So that was 1, I already said 2, and this is 3. Okay, so these big group of muscles that I'm now highlighting and kind of marking the arrows, drawing the lines with, these are called the erector spinae muscle group. Erector spinae. So the name is kind of simple, and it tells you exactly what they do. What they do is they erect the spine. Kind of straightforward. That means you can understand that they're going to have connections to the vertebrae, the spinous process, or the transverse process, as you guys will try and correlate things. That you're going to see that they have attachments to both those to these parts of the bone, because when they contract or shorten, and this is the length of the muscle, so when they contract they go in and shorten. When these muscles shorten, they're going to pull our spine up. They're going to help erect it or make us sit up straight or stand straight, and hopefully that was a nice little reminder to sit up straight or stand straight. Don't hate me. All right, so let's start with the most middle one. There's a nice little mnemonic that I used to remember. It's called ILA. It's just like an acronym, and it just helps me remember which muscle is most lateral to most medial. So this is the lateral part, and this is the medial. Sorry, should be ILS. ILS. So I said we're going to start with the most medial part. So that's the line that I'm drawing. Imagine this is the spine again. So the most medial is going to be the spinalis muscle. It's easy to remember that because it's closest to the spine. So spine, the muscle that's closest to it, is going to be the spinalis. Cool. The second one is going to be the longissimus. It's one of appropriately named because it's one of the longest muscles in our body. And the last muscle, or the most lateral muscle, is going to be the iliocostalis. So first one, most medial, is going to be the spinalis. I'm pointing out here. The intermediate, or in between, is going to be the longissimus, and the most lateral is going to be the iliocostalis. So let's see that again on the picture. I'll remove some of these lines. So you can see right here, the way these muscle fibers are going is a very, very helpful way of understanding and getting an idea of what muscle is which. So let me go to complete anatomy and pull that up for you guys so you have a better understanding and you can really see what exactly you are looking at. Just give me one moment here. I apologize for the delay. Skip ahead. Or I hope you've skipped ahead. And now we are going to be removing all the other muscles and then looking only at the level of, at the depth of the erector spinae group. So the most medial one, as I said earlier, is going to be the spinalis muscle. There's three sections that you want to pay attention to, but before we even go there, I just kind of want to help you identify which one is which. So the spinalis muscle, it's a little easier to identify because when you're looking at these muscle fibers, you're going to notice that they are running medially. And let me just get out my pen tool, and then you can notice that these fibers, they run in between. They're so if this is the spine right here I'm drawing, it starts out here and then it goes back in. So they want to turn in and they're running medially, running towards the spine or close to it. Whereas this is the longissimus, if you're looking at it right here, this section, these muscles are running outward. You can see those fibers are different. The way that the angle and these like little stripes that you see, these stripes, they're running outward. Whereas for the spinalis muscle group, they're running inward. And that's a good, helpful identifier in making sure that you haven't confused the longissimus or the iliocostalis with your spinalis muscle. Please do not do that. Or if you have confused the splenius with your spinalis. You'll also notice here that the spinalis, let me clear everything. You'll also notice here that the spinalis is still running above, but the splenius is running outward. And same thing up here. These muscles are going to be running outward. Spinalis is going to try and be running inside. It's going to be going in. Make sure you pay attention to those muscle fibers and which way they run, as then you won't be confused as to which muscle is which. Now, laterally to the spinalis muscle, as I said earlier, with the muscle fibers running out, is going to be the longissimus, and lateral to that is going to be the iliocostalis. Now, this shouldn't be too tricky as to what is what, but you do have to know which regions they are. And so there's like a simple way of kind of ruling out and confirming what is what. And for that, you really want to pay attention to what level you are at. By level, I mean if you're in the cervical area, thoracic area, or in the lumbar region. Now, you'll notice that this is the highest iliocostalis, and you'll notice that it's only on the thoracic region. It does not go up to the cervical region. But if I go up to the highest longissimus, sorry, if I go to the highest longissimus muscle, you'll notice that it goes all the way up to the head, and I believe it actually goes all the way up. It actually connects with the head, and that makes it the longissimus capitis. So those are helpful reminders, because if you see a muscle, if you see like iliocostalis that's labeled and it's super lateral, remember this is the most lateral elector spinae group, you can rule out that it kind of goes, let's see what's a better way to say this. I apologize for the inconvenience. So one way to think about it is that when you're going down from, so let's say when you're going from top to bottom, the top being capitis. No, let me write that right here. So there's capitis, cervicis, thoracis, and lumbar region. Now, I said earlier that ILS is a good way to remember which muscle group is which. Now, the idea still kind of holds true when we're going from top to bottom as well. The highest muscle, the highest section of that muscle is probably going to be the most medial. What I mean by that is that the capitis, like for example, if we're trying to think of the capitis, this is the longissimus capitis, is going to be more medial than the longissimus cervicis. And then that's the same issue. The longissimus cervicis is going to be more medial than the longissimus thoracis. So I hope that makes sense. Once you're going high, if you're at the very top, again, this is that muscle fiber that's kind of connecting to the head, but you can't see it right now because it's so deep in. But this shaded in muscle that I'm kind of drawing in here, this is the longissimus capitis. It is the most medial. The other two muscles that have been outlined are the longissimus cervicis and the longissimus thoracis. Again, there's no longissimus lumbar region. There's only these three muscles for the longissimus, these three sections of muscles to be more specific. So just like they are with the sponneus being more medial, longissimus being intermediate, and then iliocostalis being the most lateral, you will notice a similar kind of pattern when you go from top to bottom, with the cervicis being the most medial aspect, or the capitis, I guess, being the most medial, and the lumbar being the most lateral. So one good thing to know, and to help you avoid being confused if what is being labeled, if you see a really long muscle at the very end, if you see a long muscle at the very end, mess this up. You see a long muscle at the very end, and you see it's really lateral, because you can see right here. This is what I've pointed at, the diagram. This is really lateral and it's very high up. You can rule out that it's not going to be the longissimus. Like I said earlier, the cervicis part is going to be more medial. When you're going from top to bottom, it's medial to lateral. Okay, don't forget that. Placement. So if you're seeing a muscle that's super high up and it's also really high out, you can use that information and that placement to eliminate the fact that it would be the longissimus. And therefore, since then you just have to remember, what muscle is lateral to the longissimus? And there you have ILS, and that's going to be your iliocostalis. So I hope that clarifies some things, and I hope it helps you remember how to differentiate the three. So now we'll go back to an actual human body and help you understand it through there. So again, the most medial being the spinalis, intermediate being longissimus, and the most lateral being the iliocostalis. Now, if I were to ask you how to differentiate between these fibers, and again, I'm not going to go over them, but I would recommend that you remember top to bottom as to which is more medial, the cervical, let's say the capitis here, the cervical, thoracic, and the lumbar. Like, remember that the capitis is going to be the most medial part. So this right here is the spinalis. Oops. Going from right here is longissimus. So remember those muscle fibers. These are going in. They're not as clear as on complete anatomy, but you can pay attention to which way those muscle fibers are going. If they're going in, it's spinalis. Again, it's also the most medial. There can't be anything else. Now, let's say we were trying to differentiate right here, this part of the longissimus versus some other fibers. And there was, maybe let's say there was a pin. Let me make this even smaller so you guys can see it. So let's say there was a pin and it was like, identify this muscle, ID it. Now, you got to see which way it's going. Let me remove all of this junk. And you can see, what can you see? So it's going out laterally, right? It doesn't seem to be connecting to the top of the head here. So this is a different muscle group. Don't confuse it with that. It's going out, excuse me, and it's going deep. You can't quite see where it's attaching. So you can understand that, okay, now you start thinking ILA. And then you also start thinking top to bottom. Now you're like, okay, this is not the spinalis. Sorry, this should be ILS. ILS. My bad. So it's not the spinalis. Spinalis muscle fibers go in. No. Is it the longissimus? It pretty much looks like the longissimus, but let's go on. Let's also move laterally. Is it iliocostalis? Iliocostalis does not have a capitis part. It does have a cervical part, so you should be able to see something going to the neck, but it doesn't look like it's going to the neck. And well, since this diagram already made it abundantly clear that this is way too lateral to be iliocostalis, so you're left with the lumbar aspect. And because, let me remove all my shady drawings, you can see that it's going way deep. We can't see that attachment, but it's likely going to the head. It's going to be attaching up here. So that way you can say that this muscle, if you had to ID it, is going to be the longissimus capitis. And I hope that made things a little bit clear. And again, if you just want to use the top to bottom, the one lateral to that, probably going to be the cervicis. Again, I'll draw an arrow to that. And then if I was going to say ID perhaps this muscle, and again I'm just imaginarily drawing a line because this image is a little blurry, but I was saying ID that muscle, and there was the pin right at the circle. What muscle would you say it was? Well, again, we just need to use ILS. Spinalis is the most medial, and the fibers are also going medially, not it. These fibers are going out, so it's got to be one of these two. Now, it looks pretty low, so it can be either the iliocostalis or it could be the lumbar region, but see, there's going to be another set of muscle fibers with a clear definition. You can see this line. This is another group of muscle fibers. It's going to be a clear definition that there's something more lateral to it, and it's also going out. So that the thing more lateral to it is going to be the iliocostalis. Therefore, this has to be the longissimus. I know I'm over-explaining a little bit, but this becomes easily identifiable once you're actually taking the exam. And it really does become second nature. So what level would you say this is? Would you say it's so we've identified this is the longissimus. Would you say it's capitis, cervicis, or thoracis? Because remember, there is no lumbar. There's no lumbar for longissimus. So if this is the lowest, I can confidently say that this is going to be in thoracis. And you can see another way to help you remember is to look at these rib cages. These are your rib cage. The back of this your ribs. You could see that these connection points, you know that your ribs have to be between T1 to T12. I've switched it to this anatomy app to really show you that anatomical relationship. Look at this. These are all my ribs, or John's ribs, Johnny's ribs. And this is the 12th thoracic vertebra, as noted out here at the top left. Now, right next to the 12th thoracic vertebra is going to be your 12th rib. You know this. So, if we go back to the body, and you can see these bones, you know that this is in the thoracic region. If there was an ID perhaps made here for the iliocostalis, you would know this is the lumbar region because it's far lower than the ribs next to it. And this is also how deep the muscles are. They're pretty much just on top of your ribs. So it's important to know that depth when it comes to anatomy. So I hope that made things a little bit more clear. So another thing you have to know is the quadratus lumborum, which is at the bottom. Actually, I'm not sure if you do need to know that. So for now, let's just skip it. Again, these are the answers that we just went over, and it doesn't seem like we need to go over that right now. But yeah, we don't need to know quadratus lumborum. I apologize for the confusion, and let's go on to the next one. I hope you guys didn't look at the bottom answer. So let's look at the image on the left. Coolio. All right, so this arrow is pointing at the deltoid muscle. Now, these are your big shoulder muscles. If you ever see a really, really jacked dude, you see his shoulders are popping, that's because his deltoid is incredibly well defined. Like, this thing is going to pop out. So it looks like he has giant arms, but it's really his giant delts. Please don't forget that. It's going to be your most superficial shoulder muscle. It is important that you pay attention if this muscle has been reflected or not. By reflected, I mean like these attachments right here for the deltoid, if they've been ripped and the rest of this muscle is folded over. You want to pay attention to that depth to really see if the anatomy instructors are not trying to trick you, or they're trying to make you think like of all the other muscles that could have been reflected or removed in order to show you what you are now looking at. So this is the most superficial aspect. There's no deeper dissections, and you're looking at the muscles right after all the fascia and the skin has been removed. Okay, so please don't get them confused. Now that's your delt. I hope that made things a little bit more clear. Alrighty, so on the right, what is the difference here? What is the difference between the left one and the right one? If you said the trapezius is gone, then you are absolutely correct. Again, this image is fair game for anatomy exams. All they've done is they've completely cut out the trapezius right here. So you might not see the trapezius being reflected, but it's pretty obvious to see that because there's this diamond shape. It's very easy to spot. That's not there. These are completely different shapes. So it should give you an indication that the trapezius is reflected. What else would you say is reflected? If you also initially said that your latissimus dorsi are reflected, then you said a very wonderful thing as well, because now here you don't see your latissimus dorsi. And so this is really good because these two images, if you try and correlate between the two, you can see what is most superficial and what muscles are immediately deep to that. So I said over at yellow that this is the delt. Let's go over to the red. We'll just work laterally to medially. So I'm going to zoom in here. There's going to be two important muscles right here that you're going to have to know. This one is the fat one, big one. That's a major muscle. And then the one above it is going to be a minor muscle. Now, I'll explain that relationship exists with some other muscles too, as you'll see with your rhomboids as well. So this is your teres muscle, the teres. The big one is the teres major, and the small one is the teres minor. You can see right here that similar relationship seems to exist, but not as easily identifiable as your teres. So this is the rhomboids. If there was a tag right here, you would probably say that this is going to be the rhomboids minor. So this is the minor muscle, and the big fat one, it's right here, it's going to be the rhomboids major. rhomboids, rhomboids. It's fine if you spell them wrong, but please try and remember to spell them as closely as possible, because we won't take any points off if you misspell it, but if you just write something crazy, then the anatomy instructors will not consider that fair game. But if it's like rhomboids, that's probably fair game because we know what you mean. Or rhomboids, minus the actual rhomb. Okay. So now removing all of this junk, want to go over these muscles right here. So let me first go on to the anatomy app because that will make things even more clear as those are much more defined. The muscles. Alright, so this is the same thing. You saw a set of muscles going out laterally, and then you saw a set of muscles medial to that and deeper to that. Those are your arrows. Please pay attention to the way those muscle fibers are transversing. So the most superficial is going to be your splenius capitis. Now, don't confuse it with spinalis, but splenius, I believe, is like a Greek or a Latin word for bandage. So imagine like wrapping a band-aid around your hand. You can see your band-aid. Your bandage is going to be the most superficial thing. So this is the most superficial muscle. If you don't see any other muscles on top, you don't see any other muscles on top of this. So if you're presented with a picture and this is what you see, something like this, with one set of muscles going inside and one set of muscles above that going out, then you know that the one most superficial is going to be this splenius capitis. Now, the other one, slightly deeper to that, is going to be semispinalis. So let's think of it in terms of the spinalis muscle. So you know that, spinalis muscle, it's pretty medial. Remember, it was always medial. They weren't really ever going out that much. They were always staying down the middle. So this kind of follows that same idea. The semispinalis is not really trying to go as laterally and outwards as the splenius capitis. So I can hide that. And you can see it's pretty much just going straight up instead of going out like splenius cervicis or the splenius capitis. So I hope that kind of helps it out a little bit. Sorry, I clicked on the wrong thing there. So anyway, that's semispinalis capitis. That's going to be just deep to the splenius capitis. The splenius capitis. So another thing that you want to pay attention to are the nerves, because some of these nerves are going to be fair game, and I know I'm deviating, but stay with me here for a moment. The semispinalis capitis, that muscle that's attaching to the very bottom and back of your head, is an important landmark for differentiating what nerves you're looking at. There's two key nerves that you really want to pay attention to that are going through, through that muscle. The first, more medial nerve, is the third occipital nerve, also set on your structures list as occipitalis tertius, or third occipital nerve. If you write that, is also acceptable. Promise you, it's okay to write that. You don't have to be all fancy in Greek. Please don't rat me out to Dr. Smith for that. Thank you. Or Dr. Brown. All right. And then the one immediately lateral to that is going to be the greater occipital nerve, and very lateral, which is this nerve. You're going to see that it's not going through any muscle. It's going to be the lesser occipital nerve. So it's a little weird to remember these nerves, and it's kind of annoying. So I have like its dumb mnemonic way that this is a 3. Let me just say, the 3, if you turn it, it looks like an M. M is middle, so the third or the 3 occipital nerve is going to be the most middle. Or like if there's another way you want to flip it, there's 3 nerves. There's one, this is the second one, and this is the third one. Once you go out to N, you get, let's say you go from small to big. You go from lesser to greater. You can't exactly say this is the greatest nerve, but we'll just call this the third nerve. I'm just trying to think of any mnemonics, any way possible. If you have figured out another one to help you remember which nerve is which, you do you. And that's all that matters. As long as you can identify them, that's all that matters. But just to reiterate, there's only two nerves that are coming out through the muscles. Which nerves are those 2 nerves that are coming out through the muscle? And bonus question, which muscle is it? So for the nerves, if you said it was the greater occipital, and if you said it was the third occipital, you're correct. And if you said it was the semispinalis capitis, you are also correct. Way to go. You guys are learning this stuff like it's easy peasy. So let's go back to the human cadaver and basically go over what we just went over in complete anatomy. So the muscle fibers that are going out laterally, remember, splenius, sorry if I spelled it wrong, is going to be, is like that old word for bandage. So it's just going to be wrapping around. It's the most superficial, as the bandage is going to be really superficial. So that's the muscle that's going outward. And since it's attaching to your head, that's going to be splenius capitis. Don't confuse them. And then the muscle that's deep to that, which you can see right here and here, from the left and the right side, you'll see that this is the semi-spinalis, not semisplenius, semi-spinalis. Because if we took away the splenius capitis, you'll just see, and I'm just imaginarily drawing out these lines, but you'll see the muscle fibers of the semispinalis running down and into the spine. So they like to stay relatively medial, whereas the splenius likes to go out. It's kind of like a similar pattern with the ILS. These two are going out, and this is staying in. And so it's like pseudo-spinalis, I guess, if that's the one way that you want to remember it. All right. So I know these ones have been especially tricky for some people, and that's completely acceptable because we haven't quite gone over this. We've been going over the back stuff. So it's okay for this to be more confusing. I know we haven't really learned it, but sadly it can be a little bit fair game because because of the serratus anterior muscle that we have to know. You can see it's this jagged muscle that's coming out. And that's why it's called serratus, because if you have a saw and you serrate it, you have this jaggedy edge, or like this, yeah, pretty much this jaggedy edge that's coming out. So this is your serratus anterior, and it's you want to know the artery and the nerve that innervates and supplies the serratus muscle, the serratus anterior muscle. So if it's, let's forget about this for a sec. Oops. So we're going to say that it is supplied by the long thoracic and innervated by the lateral thoracic. So let me remove all these drawings. What you want to pay attention to, again, these are in the blue and yellow arrows. So if you try and follow this blue arrow down, or I guess it's at point 25. Again, if you try and follow that nerve down, you'll see where it is attaching. Always want to follow as to what it innervates. Look as to where it's going. It's going pretty much into your serratus muscle. You want to follow it all the way through. I promise you always that we're going to show you where that nerve connects. We won't show you it. We won't pin this part here and be like, oh, what's this nerve? We're going to pin it up here as we did with the arrow, and you kind of have to go ahead and make sense of that yourself. And then follow that arrow down, and then you see that it goes right into the serratus anterior muscle. The same thing with this green arrow, which is identifying the artery. So you can see that this big chunk of artery right here, there's this massive artery coming out, and then from the artery there's this little branch that poops off, and then it's going down, and it feeds into here, and it goes down, and it feeds into that. So that is going to be your lateral thoracic artery. So you know that these are going to be in the thoracic region because this is right above, this muscle is right above your right superficial, and that's what I meant by right above your rib cage. So that's why it's the thoracic. And since it's kind of going to the side, they have to travel quite a bit, and they're traveling out laterally. So remember, this is lateral, and then this part is medial. So there's like the lateral thoracic artery and the long thoracic nerve. You have to just say that a few times, and I promise you you'll get it. And I know that this was especially tricky, that's why I waited for it for the last. This was the red arrow pointing at this artery that's going down. is branching off this big thick artery, and it's going down, and it's kind of going back. So this is tricky. This is an annoying annoying thing to pay attention to, but it's definitely fair game, and it can be easily confused. So the subscapular artery is going to go and supply the subscapular the subscapular artery, yes, is going to go and supply the subscapular muscle. So that's what it says right here. The arterial supply is the subscapular artery. So the subscapular muscle has a really, it can sometimes, for introductory anatomy students, can be a little tricky to pay attention to as to where it is, because it really makes you think about what the layers are. So first I'm just going to fade everything else except for the bones and the subscapular muscle. So look as to where it is in comparison to everything else. This is below the scapula, as in it is sub to the scapula, right? So it's immediately right next to the rib cage. So, and not only that, but it has an attachment point out to the medial or the slightly more medial part of the humerus. But what is this? Don't worry, I'll charge it. So what is this tuberosity that it's attaching to? If you said it was the lesser tuberosity or the lesser tubercle, that's going to be the more appropriate term. If you said it was the lesser tubercle, then you were right. So it starts off at the medial aspect of the scapula, and it's like inside or under, to be more accurate, of the scapula, and then it goes out and it attaches to the lesser tubercle of the humerus. Then you're going to notice that this has a very interesting attachment point that makes it a little complicated to differentiate between other muscles. So out laterally is going to be your best way to identify it. There's going to be a ton of other muscles. Like if I add the most, if I remove these pec muscles, don't worry, you'll learn about them. If I remove another one, it's just like this big chunk of muscle, and all you see is the subscapularis muscle. And you only see this teeny little band of it if the deltoid isn't removed yet either. So if I hide the deltoid, now you see a little bit more of the subscapularis muscle. You don't want to just assume that we're going to be removing that deltoid to make things easier for you, but we can or we cannot. But if you see perhaps a nerve or an artery that is diving all the way back to the subscapularis muscle, then you want to think that it's probably going to be the subscapular nerve. And now that's going to be a bit of assumption on your part, and I know that's annoying, but once you get to this point, you have to think about it in terms of what you know right now and what is going to be relevant for this exam. So there's only two muscles out here, two muscles that can really be tested if we're looking at it from the front. There's going to be serratus anterior that we went over already, and then there's going to be the subscapular, which you can kind of see right here, but the rest is way too dark to see. Now, if you have to, based on what you know and based on what's fair game for this first exam, and I promise you, learn this big spaghetti chunk in a little bit, but based on that first exam, what you guys know right now is what that red artery is going to, and you see it's going back. It has these little bits that are going back, and again, the rest of it is also going back. You want to start thinking the subscapularis muscle. It's not going to the muscles here. It's not going to your arm muscles. It's going back, and it's going deep, like really under your armpits. And that's a tricky artery to identify, but it's also an order of elimination ID, identification. So you have to completely eliminate that it's going into the serratus anterior muscle. You have to eliminate that it's going to the deltoid. And then by order of elimination, you can say, like, okay, this is going to subscapularis. And that's what I would do if I wanted to understand or like correctly pinpoint. All right, guys, we're almost there. I'm glad you've been sticking around and making it through. I hope things have been explained pretty decently so far. If they're not, feel free to just ask questions as I'm sorry, as they get if this gets posted. Just text me with any questions or email me with any questions, and I'll get back to you as soon as possible. So, anyways, let's get back to identifying and navigating through these structures. So now we're looking at the back of the head. All right. So the picture on the left, right here, this is mostly a very superficial dissection. You can see that most of the muscles haven't been cut, and we've left the labels on for just like landmarks, so you can kind of understand what's going on. Sometimes the occipital artery. So if this is the midline of the head right here that I'm drawing the line through, and this he's facing towards the left. Now we're looking at his back, and you can see the occipital artery right here. It does run superficially at one point, and it runs just a little bit medial to the splenius capitis. Remember, if you remember from the anatomical body from Complete Anatomy, you'll notice that splenius capitis runs laterally, medial to laterally. And then also, what you want to pay attention to, if there's any arteries, or if there's any nerves, very superficial nerves, the most superficial of them is going to be the third occipital nerve, is noted here. It's going to be kind of difficult for you to see it, but if you see a nerve at the back of the trapezius, which is this muscle right here, you see on the a nerve on the top of the trapezius muscle, then it has to be the third occipital nerve, and that's your identifier. So don't get it confused. And this white piece of connective tissue, what I went over, if you remember, when you touch the back of your neck, you notice that it's a little bit cushiony. It serves for that protection. That's the knuckle ligament. So anyway, without further ado, let's go ahead and try and identify some of these structures. So this is color-coded. All thank you to Mariah again. And now let's go ahead and go them one by one. So in green, anything in green is a structure. So then this arrow is being pointed at probably this band of connective tissue, because that's what a structure would mean. It's anything that's a structure is going to be probably a bone or connective tissue, and you can rule out that it's not going to be an artery, a nerve, or a muscle. So in green, this structure, this is going to be the knuckle ligament, as said previously, knuckle ligament. So that's going to be the first one, and that's that thick band of connective tissue running down the midline of the neck. You can see that this is the midline, and it's running completely up and down, and you see that it kind of starts to spread out on the top of the head. So that first one, that would be your knuckle ligament. So if you remember earlier, now let's go on to the nerves, because that's what said here. Blue is nerve. This other blue is nerve at the bottom. So we're asking for what is this nerve right here. Now there's three nerves at the back of the head, or back of the neck, superficially, that you had to know. If I'm drawing midline and this is lateral, there are three that you had to know. So there's first one, which is the third. because remember, if I turn this, then it becomes an M, so that's my way of remembering it's a middle. Next to that is the greater, which I'm marking with a G, and way further laterally is the lesser. So remembering those, what do you think that nerve in blue is going to be? If you guys picked the third occipital nerve, then you were correct. And the nerve right next to it, right here, which is in red, if you picked that nerve, what do you think it would be? If you picked greater occipital nerve, then you would also be correct. See, because that is lateral to it. So we're going from medial to lateral. It's just mirrored. So I hope that makes some sense. And then lastly, there's two more structures. So in black is an artery and the orange is an artery. Okay, so let's go and talk about the orange one first. So this very superficial artery seems to be running and curving around. If you see a superficial artery and you see it on the back of the head, you want to think occipital artery. That's 100% nothing else that's available on your structures list. There's really two main arteries that you need to know that are on your structures list. You need to know the occipital artery and you need to know the vertebral artery. So occipital artery is going to be very superficial, and the other artery in black is going to be a vertebral artery, and that's going to be contained within your suboccipital triangle, which is literally just going to be this pseudo triangle formed by the obliquus capiti muscles and the rectus capitis posterior major. So in black, that's going to be your vertebral artery, and in red, which is marked right here, that's going to be your occipital artery. So let's go ahead and see if, hopefully, I was correct. That was the occipital artery, and that was the vertebral artery within that space, and going medially to laterally, the first is the third occipital nerve, which, if you turn that 3 and make it an M, that's the middle. And then you have your greater occipital nerve, and you can't see here because the trapezius is reflected, but imagine if there was a nerve out here. Whoops. There was a nerve out there that would be the lesser occipital nerve. All right. So now we're going to proceed on to the vertebral column, and there's already a dissection made here. What's happened here is a laminectomy. A laminectomy is when you have taken part of the vertebral column and cut it away. So there's a couple of bones out here. Remember, there's two bones or two parts of the vertebral column. There's that make up the arch. I hope you're able to remember. If not, I can scroll up just briefly from the drawing. Right here. So, like I said, here there's the lamina and the pedicle. So within the laminectomy, I'm just going to use this as an example. Within the laminectomy, what's essentially happened is that we've cut up this part away. So this part has been removed. So the spinal cord, as it's going through here, we need to have the ability to see this. So while it's going through here, what we do is we take a saw and snip these two ends off. And what that does is gives us a direct view to look at the spinal cord. So now, right now, this view of the vertebral column is top down. We're looking at it from above, for example. So just remember that the vertebral body is anterior. The vertebral body is at the very front. And the spinous process is posterior. It's at the very back. So keep that in mind as we go forward. So I hope you didn't see that. So as I said earlier, with a laminectomy, what we're doing is we're removing parts of the vertebral arch. So you know that was the pedicle and the lamina on each side. So since the lamina and the pedicle have been removed within a laminectomy, and that's going to be every laminectomy period. That's how the procedure goes. We don't remove the anterior parts because remember, the anterior parts are the weight-bearing regions. Those regions are absolutely critical. If you remove them, then things are going to get crushed, and we do not want that to happen. So we remove the parts that are not the weight-bearing regions. So that's going to be your lamina and pedicle, and your arch is gone. So what we're looking at, this perspective, we're directly looking at this from the backside. So this is deep to all the back muscles and deep to the vertebral column, and now we see the spinal column. So please don't confuse the two. The vertebral column is made by the vertebrae, and the spinal column is made by the nerves. So there's 4 structures here that we have to take note of. The first one is, so it's 8, 9. Let's start with 7, 8, 9, and 12. So 7 is going to be right here, 8, 9, and 12. All right. Okay, so this is 7. So what is a nerve? This is a nerve. What is a nerve that is shown at 7? So remember that we're looking at this from the back. So any of the nerves that are coming out of the spinal cord are going out to the back. But notice how this is more of an oval / circle-y shape. You know, you can see that it isn't similar to the other nerves. The other nerves are going straight. But before they go out, there's this little bit of a circling outpouching that gets thicker. Same thing here. It gets thicker, and then the nerves branch off. So number 7 is directly pointing at this thick region. What is that? If you said that's the dorsal root ganglion, then you are correct. Because remember, think about it. We're in the back, and if it's a thick, circly shape, this is where the nucleus of the nerves are going to be, or the nuclei of all these nerves, because each nerve is really microscopically tiny. So that nuclei is going to end up making this kind of circly shape. So think about it, even if I drew it, maybe that would help give a better image. So you have this nerve that's coming out, you have these dendrites, they go out and they go and feed into this nucleus, and then out goes the axon, right? So then that's the same process here. They are getting an input before they reach the nucleus, and then number 7 is specifically the dorsal root ganglion, where it gets the input and where it helps coordinate the electrical signal as to where it should go. So next one, that was number 7, and next one, let's go to number 8. So number 8 shows this little skin, basically the skin of the spinal cord. Now you look at the skin, it looks thicker, more durable,